Stillwater's Morning Scramble. Glad to have you here, and glad to have the mayor in. Will Joyce, good morning, Mayor.
Good morning, Steve. How are you today?
I'm doing great. Michelle's here for the opening little segment, and I think
Hey.
Wayne Bovington will be sliding in. We've got the one other person is allowed in the room as long as they stay far away.
There you go.
And that's really what we're trying to do in
Good morning,
town, right?
Michelle.
Good morning. How are you, Will?
I'm doing okay. I did enjoy your Murrah building piece that you guys were talking about. I mean, it was, I know Carrie, and I did not know that story about her.
I didn't know it
that
till
was
last
really
year.
Moving piece.
Oh, thank you. Thank you. You know, it's a big, when you're dealing with people's lives, I mean, I don't think people realize how seriously we take it, but when you're telling a story like that about something that happened to someone, especially when it's something that is obviously very impactful like that, it's a big responsibility. You have to take it really seriously, and you have to try to be really sensitive about it. So,
Well, you did well.
thank you.
Yeah.
Thank you.
And there's a lot of people around here who have first-person accounts that we don't know
Yes.
of. I first got to know Chief McNichol during that time.
Right.
And he wasn't there at the time.
Right.
But he had been in the building in a meeting, just days before, and
Sure.
he knew a lot of people in there, and he was somebody who was a responder. And
Absolutely.
so just folks that we see all the time, and they've been through a lot, and
Yes.
it's hard. In a way, it's hard to believe, and in a way, it's not. That it's been a quarter of a century.
I know.
So, where were you at that time, Will?
I was a sophomore at Stillwater High School in Dr. DeFee's American History class, and at least that, later that morning when he had a TV rolled in, and we sat and watched coverage in his classroom that day, and sort of, kept on what was going on. My dad was actually supposed to be at a meeting at the Murrah building that morning.
Wow.
That had been postponed just, the day before or whatever.
Wow.
So you knew he wasn't there, though, right?
Yeah, I didn't. I know at the time I had no idea.
Right.
Your dad goes to work. I mean, you
Right,
don't know what
that's
he does
right,
during the day. So, but no, he told us later that was, he was supposed to actually have been there that day, but
Ugh.
the meeting was postponed. So,
Wow.
yeah, I mean, I distinctly remember sitting and watching all that happen, and then, right afterwards, and gosh, unbelievable that it's 25 years ago, and hard to believe, honestly, that it happened, and that we had that kind of event here in Oklahoma.
Absolutely. So, it rocked the world, changed the
Yeah,
world.
It did.
So, hey, we're in another one of these world-changing events right now.
Yeah,
So, and
yes, we are.
I read your lengthy summary. I imagine you put it on Facebook first. I don't know, but it's been 2 years, which I didn't realize it's been 2 years since you were elected mayor. So,
Yes.
Yeah, it has. It's felt like about 6 just in the last 3 weeks. But yeah, it's been 2 years. I did put up a post. It's certainly been a little different here over the last month or so than I expected, and a different set of challenges to deal with than I think any of us would have thought, kind of coming into this thing. But Stillwater's just, the community has really stepped up in a lot of great ways, and not surprising at all given what we know about our state and about our community. We've been through tragedies and dealt with the events that we've dealt with here in Stillwater, and as a state in Oklahoma, we've always shown, I think, that ability and willingness and the sense of community to step up and help each other and figure out how to get through challenging times, and we've seen that here, just like we have seen it in the past. This is a longer term sort of a deal, right? I mean, it's not just a kind of a one thing you have to recover from. We're going to keep going through this for a while, but I've been very just proud of my community and seeing what they've done over the last few weeks and how they've stepped up to help each other.
In response, the first thing you hear sometimes are the people who disagree and want to have that heard. But it seems to me like most people, 80 to 90%, are right on track with where you're thinking and appreciative of the fact that we did take an aggressive stance to start with. Is that the feeling that you get?
It is, yeah. By a long shot, by a large margin. The comments that I get and the questions are very much in favor of the kind of cautious approach. Making sure that we're not, reopening too soon or not, taking chances that may have a large impact. And it's such a difficult situation being in a smaller community, outside of the big sort of outbreak areas on the coast or even in larger cities, and trying to kind of weigh all that. But I think, like you said, the vast majority of people understand that, people travel from place to place, and just because you're in a smaller community doesn't mean you're at less risk. And, a lot of times it's even bigger problem because you don't have the resources that those larger communities have to deal with, situations like this from a healthcare perspective or, from other areas. And so, the risk to our community, while, we're not a highly densely packed urban area, the impact on us is actually, a lot larger, disproportionately larger, because of the fact that we don't have, the resources that those communities have. And so an outbreak here, or even a smaller one, can have a huge impact. So people, I think, understand that. I've gotten a ton of support from folks at the hospital and from doctors in town and from the healthcare industry in general and professionals, who really do understand firsthand that, from their friends in other parts of the country and what they're seeing in other parts, that we are, in a better position here, and that's because of the work we've done. And so, they've been very supportive, and those are the folks, those frontline people who are having to treat patients and who are going to, potentially be put in situations of having to make choices about who to treat, like we're seeing in other parts of the country and other parts of the world. Those are the folks that I really, I'm talking to and saying, we don't want them to have to be put in that situation, have to make those choices. And so those folks, have a voice to let us know what they're seeing, and we've been in contact with them a lot and gotten a lot of support.
When I look at the position that Payne County is in, Will, I mean, in terms of our numbers and everything, we're doing pretty well. We were a little bit, we were a little bit higher at one point, and then, other counties really took off. I mean, you look at like Washington County and some of those counties where, things just went nuts up there. And we've been very fortunate. I think it seems like a lot of that is because, frankly, Stillwater took pretty aggressive action pretty early, or very proactive, and we make up a large percentage of the population of the county.
Yeah.
But that's also in spite of the fact that we were kind of surrounded by hot spots, right? And these are, and in these other counties where, they did have, higher numbers as well, people come to Stillwater to shop. People come to Stillwater to get medical care. People come to Stillwater to work from those counties. So, I mean, we did have a pretty significant risk. What has to happen for you to feel comfortable about relaxing some of this stuff? I mean, they're talking about this three-phased approach, and obviously there's criteria for that. It sounds like testing needs to be a part of it.
Yeah.
What's going to have to happen, and how much testing are we going to need? What kind of testing before you guys feel really safe starting to roll some stuff back?
Yeah, so, it's a great question, and you're right. I mean, I think the universities, step very early to keep students from coming back right after spring break probably played a really big factor for us as well, because that would have been a big chunk of the population. So they were saying online classes for 2 weeks back, almost a week before we made larger, orders around the city. So, there's a lot that kind of went into helping keep that down. But in terms of opening back up, testing is huge. We're still not testing broadly enough to know, especially the mildly symptomatic or the asymptomatic people, if and those folks that have the disease that don't really show a lot of effect from it are not getting tested, but they are absolutely spreading the disease. I mean, the science around that from everybody at every level is clear that people who, don't know that they have it are spreading it, and we're not testing for those people. And so seeing 20 or however many cases, overall, or 6 active cases, or however kind of cut the numbers up, are not accurate depictions of what's actually happening in the community. So we've got to get broader testing. Being able to test, especially healthcare workers, I think is the first step, and that's actually one of the things that the president's plan talks about, which I actually think is a really great phased approach. When I say great, I mean it really does take into account you've got to see some decline in the cases. You've got to see great, robust healthcare testing. So, because when you take a test, if I take a test today, let's say I was exposed over the weekend, and I go in and I take a test today, it may not show up until that virus sort of replicates inside my body and gets to a point where it would show up on a test. That may be Tuesday or Wednesday. So just having taken a test on Monday doesn't mean much. We've got to be able to test people multiple times, especially healthcare workers, to make sure they're not in a position where it starts to spread in a healthcare setting. So that's definitely one of the things we need to see. We need to see increased testing, especially among healthcare workers, before we kind of start slowly that first phase of, some things can open. There's still going to be there's going to be mask requirements. I saw this morning, I think that Walmart announced they're going to require masks for all their workers everywhere, and I think that's a reasonable thing for everyone to expect to have to do in public.
Well, could I ask you, did you have any input? I know that's a national thing, but do you feel it is a place where you need to be, where you talk to folks like that? Because I think nationally they are. This morning they're all wearing the mask and everything. But it did send off a bad optic, I thought. Not to bash on Walmart, because they did a lot of things right and they helped a lot of people. But when you had probably 3/4 of their employees not wearing gloves or mask, the optic was not good. Right. And so do you feel it's something you can do to reach out to places like that and say, what do we need to do to help?
Yeah, I mean, we have tried locally. We've had those conversations. We put up kind of a protocol for our local businesses that were still open, and sort of said, here's the things we expect you to do. Every business is different. You don't want to try to put just these one size fits all rules, but you do want to try to give them some guidance about what we expect. And we have been talking to them that as we start to reopen, the places that have come and asked me, hey, when can a beauty shop reopen, or when can this reopen, and what's going to have to be in place? We've been pretty clear over the last week or so that masks are definitely going to be a part of that, and having people, both your employees and people who come into your store wearing masks, is going to be a requirement, and so people should start to plan for that. Now that's it's a difficult thing. Those are still from a commercially available perspective, still not necessarily widely available, kind of hard to get a hold of sometimes, and people in the public, who don't sew themselves or don't have somebody who can make one for them, or sometimes they're going, well, I don't know, how do I get one of these? So we've been trying to just be a little bit more, tell people about it. Okay, this is what you need. This is how you can make your own if you don't have one. Even a bandana will work. Just something that helps. And again, masks don't keep you from getting sick.
Right.
Putting a bandana over your face when you're out is not going to keep you from getting the disease if someone comes and coughs in your face, or if you touch a surface that someone has coughed on and then you rub your eye. Right? I mean, that you're still going to get sick. A mask doesn't keep you from getting sick. It does help if you are asymptomatic, or not quite, you haven't quite got to that place where you've been tested and you're sick, and you are out in public. It keeps you from spreading it quite as broadly. It doesn't, no one is saying that masks are a magic, weapon here, that no one's ever going to get sick again if we all wear masks, but it absolutely does slow the spread of the disease, which is exactly what we're trying to do, and we've been trying to do with all these measures. So those will be requirements as we move forward, for sure.
Yeah, we're going to go to a break here, but before we let Michelle, we're going to change guest here. Wayne's going to come in here. But you went to school in Bartlesville, and you mentioned Washington County.
Yes.
And I don't know if you've been talking to those folks over there. I think nursing home was one of the primary causes, but that just breaks your heart to see it was in triple digits fairly quickly.
It just blew up fast,
Mm-hmm.
And it does seem to be the long-term care centers and the nursing homes that are really driving this. These places that have, and once it gets a foothold in one of these facilities, it's really, really dangerous, because obviously this is by definition a vulnerable population, the entire population there, and testing for the workers going in and out of these places is going to be huge.
Oh, yeah.
It seems like that's got to be a top priority.
Yeah, and that for sure. Those kinds of facilities, the kinds of places where you have vulnerable populations that, just there's no way to necessarily, you can't send all those people somewhere else, right? I mean, they're
Right.
going to have to be in somewhat close proximity. And I know that, locally ours have taken substantial precautions. In fact, I went out with my kids on a bike ride on Saturday, and we rode past West Haven, and I saw two people talking through the windows to people inside the center.
Yeah.
One lady had set up her lawn chair outside the glass door and was talking on her cell phone to the person on the other side, so they could see each other, but they were on different sides of the glass and were still talking. So I mean, it's a huge. You need visits. You need people to be able to talk and still see their family, but they've taken really big precautions to keep people from trying to transmit that. But absolutely, testing for workers in those facilities, for the patients in those facilities. Again, as soon as you pass the test once doesn't mean you don't have it, and doesn't mean you can't get it again. There is there's not really any evidence at this point that having it once keeps you from getting it again.
Right.
They're trying to do that testing. They're trying to do the antibody testing and all that sort of stuff. But, at this point, there's no indication that there's any kind of specific or strong immunity that's granted from having the virus once. And so, it's really hard for us to say there's anything you can do other than frequent testing and keeping your distance.
That's why we can't rush back into things, because we really don't know.
Exactly.
Right.
Yeah, I mean, and people who talk about, there's this conversation about herd immunity, and well, if you let 60% of the population get it, then, those people won't get it again, and it slows the spread that way. But that's not, with this specific virus, it hasn't been established that that's actually the case. And so, infecting or just being sort of laissez-faire about it and saying, well, let's just let a wide swath of the non-vulnerable population get it, and that will actually help us recover from it. Well, maybe over 2 or 3 years that's the case, but we don't have any clear indication at this point from the research that will help in the short term. And that, allowing that kind of a chunk of the population to be infected means you are going to have, even of those younger populations, even of those less vulnerable populations, you are going to have 15 to 20% of them that end up in the hospital, and that's just not acceptable from a healthcare standpoint. We do not have the facilities or the resources to handle that many people being sick, and so as we can talk about, eventually, yes, lots of people are going to get this. Eventually, there will be a vaccine. Eventually, we'll develop, sort of a flu-like immunity in some respect to something like this, where part of the population has some resilience, but we're not there yet. And getting there in that kind of a method would be absolutely devastating to the healthcare industry in the United States. So, social distancing, wearing a mask if you have to be in public, maintaining your distance from people is still the only proven method to keep this virus from becoming an even more overwhelming problem in our community.
Well, Will, I was looking at the governor's executive order report, that came out over the weekend, or I guess they come out on Friday, Monday through Friday.
They come out. I think they come out every day. But
well, the health department sends it out every day, and then there's certain parts of it that they only update Monday through Friday.
Okay.
But the number of recovered and things like that. But I mean, you see the little things on the TV news and everything. It's showing 2,559 or 99 cases, 140 deaths, 307 hospitalizations. But when you dig down into the other report, about half of those, there's 145 people currently hospitalized. So out of those cumulative hospitalizations, half of them are still there. And about 2/3 of those people, 89 of them, are in the ICU. So, I mean, the people who are in the hospital are still in the hospital, a lot of them, and they are very, very ill, is what people need to realize. And then there are 162 more people who are under investigation who are hospitalized. They just don't know that they have COVID-19 yet. And then there are 449 more people who were seen at the hospital and then sent home to self-quarantine, the way Shiloh was talking about. Right. So when you see that 307 number, that number is a little bit low. There are a lot more people than that would really
Yep.
indicate. People need to realize that there are a lot more people who are actively sick out there, and these are people who are symptomatic.
Yeah.
So, I mean, do you have any?
And
Yeah, go ahead.
that's a small percentage of the people who actually have the virus. I mean, the people who are symptomatic, half of the people who have the virus may not be symptomatic, right? So, I mean, the actual spread is much larger than those numbers would indicate.
Have you gotten any indication when those antibody tests might be available?
I haven't. I know that, I saw from the state health department that they have started some trials, and they are doing some of those tests to try to, I think, to tune in the testing more than anything. And their initial indications is that it's a very small number of people that they've seen that have the, that show up in an antibody test. But I don't know how wide that testing is or how they're picking people or what. But I don't think, it'll be a few weeks, I'm sure, before we have a widespread antibody testing. And again, we're not sure that means much, right? Just because you show the antibody doesn't mean you're, completely resistant from.
We've never talked this much about antibodies. Seriously,
I know.
And the proteins and
I know,
all that
so
stuff.
much science, right? We're all learning so
mean,
much.
The amount of stuff I've learned in the last few weeks about how diseases work and the stuff we've read.
And some of the stuff you read or hear, you go, he seriously said that? Dr. Phil did not have a good week last week. I mean, he actually said we don't close the country down for swimming, for drownings, and not exactly the same thing, right? So,
it's not, and he also way overstated the number of people who drown in this country. Accidental drownings are like under 5,000 a year,
and they're not contagious.
No, and they're not contagious, and that I think one of the things I keep hearing is that 97 or 98% of people survive this disease, which is true, which is great. But I don't think people understand the math of 2% of people dying. If you infect, if mass numbers of people in this country are infected, those are huge numbers.
Right.
They're huge numbers, and the 99.8% of people survive the flu. So you're orders of magnitude different in terms of survival rates, and so there's a lot of that conversation that happens, and again, it's a big majority or a big minority of people who are sort of brushing this off or saying it's not as big of a deal as you're making it out to be or whatever. But there's just no way to look at any of these numbers and not say if we don't act and if we don't keep these restrictions in place, that this would not be a catastrophe for our local healthcare system and for our local healthcare system statewide and nationally if we don't try to do what we're doing and keep these efforts up, because it will be bad if we stop too early.
No doubt. Good break to go. A good place to go on a break right here. Michelle, I'll see you next Monday.
All right.
We'll take a time out and we'll go over to anything else that the mayor has out there, and we'll also bring in Wayne Bovichin, so he may have other questions to fire, a different angle. He'll ask how things are going in Michigan. Michigan's been in the news too.